absolutely agree. And I know I was looking further into advanced care planning because I know that there has been some changes around that and the filing for that. Uh, I think that those are important. I think that those are opportunities, even smoking cessation. If you have a smoker and you talk to them about smoking cessation, right, that's an opportunity too, to potentially address other things with the patient. And then also to your point about having an opportunity, right, to make that bill, right, or be able to put more into the visit for the patient that the practice can then bill as well. I would say that I know that that's applicable to our fee for service contracts. A lot of times, too, if you're in a Medicare Advantage plan, you have the ability, and you'll want to look at your contracts if you're a provider group with health plans where you're taking risk. There are opportunities where you can bill Medicare separately on those charges for doing those types of services. A lot of times, though, you have to look at how your systems are set up, how you're submitting your con or your encounters, because some of those encounters, right, are capitated just naturally under your contract, and oftentimes it's going to be that office visit. The 99213, 99214, 99215 are going to fall under your capitated arrangement, and so it may be missed. But I would say definitely look at the annual wellness visit as an opportunity to provide those services. Not only is it an opportunity to add to a revenue stream, right? But we know that they're oh so important for patient care. And then I would say I would also advise you to look at how are your systems set up, because those modifiers, right? There's an opportunity that they may have be filtered. And so you want to make sure that they're being recognized. And then look into the opportunity too. There is the potential to submit separately, where you may be able to recoup monies on those patients as well, in other ways. But I know physicians have done that have billed like the smoking cessation separately, and being reimbursed for that. But a lot of times under those capitated risk-bearing arrangements, they're not able, they don't get extra funds for that because it's included. If it's typically a covered service under Medicare, it's also then included under the risk arrangement. And so it's capitated. Not always. I mean, it depends on what's negotiated. Sometimes there's extra fees outside of that that can be, that the health plans will pay, or the MSOs will pay, right? Depending on what type of framework that you have, will pay the physicians. But you really want to look deeply into those. And if you're not being paid, I think it's definitely an opportunity to renegotiate your contract. And that's always something that can be done because these are important, right? They're important to gather on the patient. And I think that any risk bearing entity is going to want to, have that data.